Hello everyone, welcome to the 2-Minute Ortho. I'm Dr. Loy. Today I'll talk about bunion surgery, also known as bunionectomy, along with scuff osteotomy. It is a common procedure done by many surgeons, including myself, to correct mild moderate to severe form of Hallux Valgus. It may be combined with other osteotomies and soft tissue procedure in severe cases. I hope this presentation will benefit patients and junior doctors to have a clearer picture of the procedure. So what do we need? The procedure is to be done in an operating theatre with a team of anesthetists, surgeon, scrub assistants, and other supporting staffs. Before the surgery, you'll be explained the indication for surgery. Persistent pain and discomfort despite shoe modification and orthosis, difficulty in wearing the shoes, and partly for cosmetic appearances. You'll be explained the procedure of the surgery which we covered in the presentation later on. The risks of the surgery which include recurrence, risk of infection of less than 1%, risk of nerve injury of less than 1%, and delay or poor bone healing. Finally, expected outcome. The wound should heal in 10 to 14 days. You can bear weight immediately on the operated foot, but with caution for about 6 weeks, and a toe spacer during the period as well. Your lung, kidney, and heart function will be reviewed by anesthetists, and upon fit, you'll be informed the mode and procedures of anesthesia best for you. They will make sure you have painless surgery and your post-operative pain well controlled. Here we are in the operating theatre. Step 1. Cleaning. We shall paint the entire foot and leg with povidone iodine to ensure the surgical field is bacteria-free. Step 2. Incision. A longitudinal incision is made over the bunion and extended towards the toe and the ankle. It is about 6 to 10 centimeters. The skin is lifted like a flap and the deep tissue is divided to expose the bone, which is the first metatarsal bone and the proximal phalanx of the big toe. To explain the surgery better, I have surgery illustrated in these windows. Top view is how you visualize the bone from the top. Side view is how you visualize the bone from the surgical wound. Front view is how you visualize the bone from the tip of the toe. Note the bony deformity over the side of the bone in the top view. This is part of the culprit causing the bunion. Shave the bony deformity using a saw and remove it. Step 4. Cutting the bone, which is also known as osteotomy. The osteotomy is performed on the first metatarsal bone in interlock Z manner, also known as scuff osteotomy. The cut is illustrated in the dotted lines in the window. Step 5. Once the bone is divided into upper and lower halves, it is translated in a push and pull manner to correct the deformity. The bone closer to the toe is pushed closer towards the second metatarsal bone. Step 6. The new alignment is secured with 2 screws. Headless screws are preferred to ensure the head of the screw are flush to the bone. Once the bone is secured, the overhanging bone is trimmed with a saw and removed. Step 8. The tissue over the previous bunion site is being sutured and tightened. This will bring the proximal phalanx of the big toe towards neutral. Sometimes, additional small incision is needed over the first wet spaces to release the tight inner tissue and allow better correction. The wound is irrigated with large amount of normal saline. It is closed in layers with absorbable sutures. It is dressed together with toe spacer as well. This is the illustration of the attitude of the toe before and after the surgery. Thank you. I hope you enjoy the presentation.